Now kindly request Dr. B.N. Gangadhar sir, our chairperson of the National Medical Commission, to kindly address everyone. We thank you, sir. You've again been a part of Medscape India, Fit India movement, and with Dr. Sunita Dubey. We're eagerly waiting to hear your words of wisdom, dear sir. Dr. B.N. Gangadhar sir, we welcome you, sir.
Wish you all the best for the Doctor's Day function that you are. Uh, I've been in touch with your people on this matter. Medscape is doing a good job about enlightening. I really appreciated the first introduction from the Medscape people that health is our duty. I totally endorse. That does not mean that I pass the buck to the public, but I should, as a doctor, be an advocate of this concept. Health is my duty. That means health is the duty of every individual. Preserve the duty. Only then they can be a worthwhile contributors to the country. Unhealthy people, for whatever the reason, we have to care for them, but ensuring this statement again that we all should take care of ourselves first. And then being a doctor's day, I think I will have to also say a fit doctor is the best doctor. So a doctor also has to be fit in addition to having other skills, knowledge, ethics, and so on and so forth. He or she being healthy is equally important. So this is something that I want you all to take it forward. Fit India, fit doctor also, which means every doctor in their 5 year, every medical student in that 5 year period and then the next 3 year period, and later on as well, should guard their health and can't say that this that is the excuse. And so I neglected or I went into using drugs, nicotine, and so on and so forth. No excuse for using these things should be allowed, and a person should guard his or her health as much as is possible. In fact, the physiology departments of all medical colleges should monitor the health status of the physiology of the individual, whether it is weight, exercise tolerance, and the BMI, and so on and so forth, every year, so that the boy or the girl who joins the course at 18 age should go back in a better fit condition at the end of the 5 year course, at least preserve that condition of fitness. So this is something that as Medscape should go on to advocate in all the medical education systems, and we will also be hands in glove with you. And there has been a thought that in NMC should actively canvas for a healthy medical education, which means healthy medical education for the given individual to remain as healthy as possible. Having said this, there's another aspect which I want to emphasize here. To the medical commission, to the National Medical Commission, every student is very, very precious. Every student's life is very precious, just as much as his health or her health is precious to us. Because we believe that this person is going to be groomed into someone who is at the higher pedestal in the society, a person who is going to dedicate, who has come here to sacrifice in terms of whatever maybe his personal needs, but to work for the society. In the meantime, it also becomes responsibility of not just us, entire society, and we believe the medical student, UG or PG, and subsequently the doctors who are registered with the NMC are all precious gems of this country, and their health should be guarded. Although we say it is their personal duty to guard the health, but I think our role is to ensure their safety, their well-being, and they make sure that they go through the process of medical education and remain fit in the medical education and thereafter as a medical doctor to be able to serve this country. With this motto, we have been working. Even just yesterday, the NMC had a hearing with some colleges where PGs had been tortured or not tortured. Actually, there are some complaints from their colleges. We continue to keep doing this, ensure that the colleges provide the most healthy environment for medical education. Another point which I thought we could just munch over here, maybe as a viewpoint, we have taken cognizance of the fact that the number of hospitals have more beds than the PGs they have admitted, and we are encouraging them to make sure that more PGs are admitted. If there are more beds, more patients in the hospital, so that more PGs will take the clinical. I don't want to use the clinical load as the term, but the clinical services will be shared by more PGs so that best to the patient is given and the less stress will the student be having to see more patients if there are fewer PGs. So this is some message that we have sent out, particularly to the government hospitals where the crowd is very humongous. So if all colleges, if the beds are more, patients are more, they're admitting them more, but they have a fewer number of PG students, please ensure that your numbers of beds are covered by more PGs if it can be allowed. With these few words, once again, my best wishes to all my dear students who are in UG and PG courses. We are all with you, and NMC is endeavored. It assures that the best care is offered to all the students during their course, and of course, the same to all the doctors, wishing them the best healthy life in the days to come. Thank you very much, and good luck.
Humble thanks to you, Doctor. Sir, you've given us so many tips, right from starting with a fit doctor is the best doctor to going ahead and allowing all of us, whatever challenges the medical fraternity faces, you've given us solutions for the same. We truly appreciate it from all our heart. And we are definitely going to take this tagline. It sounds very good as well. A fit doctor is the best doctor. I know that doctors always believe in giving and they genuinely don't get time for their own selves. But the fact that you said that irrespective of what, you have to take care of yourself and as at the same time, look after one and all. I think there couldn't be a better feeling than this. We're truly thankful to you, sir. Thank you so much for your message and for joining us here and for sharing this positivity to the world. Ladies and gentlemen, please join us as we welcome Dr. Sonalini Ketrapal, team-led Health Sector India Asian Development Bank, and she shall highlight on financing the future of health education in India, which Dr. B.N. Gangadhar sir also spoke on the health education. Let's please take a look at Dr. Sonalini Ketrapal. We welcome you. Doctor, thank you so much. Dr. Sonalini.
Good afternoon, everyone. It is an honor to speak to you today on the topic that is not only vital for India's progress, but also deeply personal to the community at large, financing the future of health education in India. India stands at a crossroads. With a population exceeding 1.4 billion, the demand of quality healthcare and well-trained professionals has never been greater. Yet, the backbone of the country's healthcare system, health education, remains underfunded, unevenly distributed, and often inaccessible to those who need it most. Why health education matters, you may ask. Health education is more than just training doctors and nurses. It's about building a resilient system that empowers communities, prevents diseases, promotes well-being. It's also the foundation of public health, clinical excellence, and innovation. But to realize this vision, we must invest strategically, sustainably, and inclusively. However, despite progress, India faces several challenges. Limited public funding, government spending on health education remains below global benchmarks. urban-rural divide, most medical education institutes are concentrated in urban areas, leaving rural populations underserved. Infrastructure gaps. Many colleges lack modern labs, simulation centers, and digital learning tools. Faculty shortages, attracting and retaining qualified educators is a persistent issue. Financing the future, a multi-pronged approach is required and need of the hour. We must fund or increase investments in public financing. The government must increase financing for health education, especially in underserved regions. Establishing new aims-like institutions and upgrading existing colleges can create a ripple effect of quality and access. ADB has been actively involved in supporting the central and state level governments in realizing this. Private sector participation. Public-private partnerships can bring innovation, efficiency, and capital. Private players can help build infrastructure, offer scholarships, and support research. Especially post-COVID, the role of private sector stands very pronounced, and it has come to become a major contributor of driving growth and addressing gaps. Technology-driven solutions. Investing in digital platforms for remote learning, telemedicine training, AI-based simulation can democratize even access and reduce costs. This is particularly important for ADB operations, and we have a renewed focus on supporting in the development and adoption of digital solutions. International collaboration. Partnering with global institutions can bring best practices, faculty exchange programs, and joint research initiatives. ADB's strong presence in Asia-Pacific region helps mobilize these strong partnerships of knowledge exchange. Community-based financing. Local governments, NGOs, and community organizations can play a role in funding grassroots health education programs, especially for paramedics and health workers. Recognizing this, a strong focus of our engagement at grassroots levels remain very central to our portfolio. We do finance community-based initiatives, and we hope for hand-holding support through successful demonstration of innovations or introductions of new interventions. The road ahead. Financing health education is not just an economic decision. It's a moral imperative. Every rupee invested in health education yields exponential returns in terms of lives saved, diseases prevented, and communities uplifted. We hope to continue to support medical education where every aspiring health professional has the tools, training, and support to serve with excellence. Thank you.
Thank you very much. That was really, really kind of you and heartfelt conversation that you had with the entire world. Humble thanks to you, Doctor. Ladies and gentlemen, as they always say, doctors stitch the stars in broken skies and dream for those with closing eyes. Each breath they guard, each pulse they chase is born of hope, is touched by grace. May we please present to you the Doctor's Anthem right now by Medscape India. Please join us for our Doctor's Anthem, and let's express our heartfelt gratitude to every doctor across the world who's been a true miracle of the divine.
ना दुख की तुमको धूप लगे, ना सांसों की टूटे लड़ी,
सांसों की टूटे लड़ी, ना सांसों की टूटे लड़ी। ना दुख की तुमको धूप लगे, ना सांसों की टूटे लड़ी। ना फिक्र करो, ना फिक्र करो, ना फिक्र करो, ना फिक्र करो। हर लम्हा हर घड़ी तुम्हारे साथ हैं, हम तुम्हारे साथ हैं, हम तुम्हारे साथ हैं, हम तुम्हारे साथ हैं, तुम्हारे साथ। Doctors, we're always there for you. We are the doctors, we're always there for you. We are the doctors, we're always there for you.
भगवान नहीं इंसान है हम, सेवा के लिए कुर्बान है हम।
भगवान नहीं इंसान है हम, सेवा के लिए कुर्बान है हम। सबके लिए दिल में जगह मानवता की पहचान है हम। ना फिक्र करो, ना फिक्र करो, ना फिक्र करो, ना फिक्र करो। हर लम्हा हर घड़ी हम तुम्हारे साथ हैं, हम तुम्हारे साथ हैं, हम तुम्हारे साथ हैं, हम तुम्हारे साथ हैं, तुम्हारे साथ हैं।
ऊपर वाले ने जन्म दिया, हम इसकी सुरक्षा करते हैं।
ऊपर वाले ने जन्म दिया, हम इसकी सुरक्षा करते हैं। जहाँ हो ना कोई तकलीफ कभी ऐसी व्यवस्था करते हैं। ना फिक्र करो, ना फिक्र करो, ना फिक्र करो, ना फिक्र करो। हर लम्हा हर घड़ी हम तुम्हारे साथ हैं, तुम्हारे साथ हैं, हम तुम्हारे साथ हैं। We are the doctors, we're always there for you.
Thank you, doctors. Thank you for always being with us. This is the Doctor's Anthem by Dr. Sunita Dubey. And here at the Fit India Conclave 2025, we truly salute the spirit of all the doctors. And I'm very excited to introduce all of us to that very renowned international doctor who's been the complete healer for the world. I'm going to say two lines before I introduce this very amazing, soulful Dr. Ali Irani. The guardians of breath, the artists of healing, the warriors who fight not with force, but with compassion. Let us stand today not just in admiration, but in gratitude for your skill, your sacrifices, your unshakable humanity. It's absolutely a huge honor for all of us to truly thank all the doctors in our lives. May we please have the pleasure of getting to hear from the world-renowned doctor who's been with the superstars, the supermodels, and the topmost cricketers across the world, along with being the soulful doctor, helping each and every individual without thinking about any barrier regards finance. Dr. Ali Irani, we welcome you. Thank you so much for joining us here at Fit India Conclave. May we please have the pleasure of getting to hear your words of wisdom so that we could be the best version of ourselves, physically, mentally, spiritually, and holistically. We welcome you.
Yeah. Good afternoon and namaskar to everybody. I'm grateful and thankful to Dr. Sunita Dubey to start Medscape, which I'm associated for the last 8 years. And I hope all the people who are listening know the job done by Medscape, from going to the slums to the diagnostic to the treatment, reaching out to people rather than people reaching to them, especially the underprivileged. And her thought of making this as a big event for people behind it who make all this happen, that are the doctors from all specialities. So this great work was done, and she has been identifying the people working towards healthcare and then awarding them. And then the next year came all the institutes or the hospitals that did great work, and they were rewarded and awarded. So it was a great thing that happened, and I'm thankful that I'm associated with her and her Medscape. And with the slogan coming Fit India, it really, we are doing a great job on that front, especially the physiotherapists of the country. We are all into prevention. We are working on prevention. And with the guiding and being always behind us, Dr. Dubey, we saw to hit K today. Every district in India has a cell of physiotherapy which works in that area. Every year we celebrate the on 8th September the World Physiotherapy Day. Similarly, the Doctors' Day on 1st July, which happens today uh, for calendar year. And great works are done. We have camps. We go to the people. We serve them. We treat them, and don't charge them, and explain them what are the areas where fitness can we can offer. So yes, physiotherapy does work on the prevention level, and as the slogan goes, prevention is better than cure. And still, if you can't prevent you and you fall ill or get any problems, again, we have all the specialists, and all the specialists are being honored here. Coming to the topic of base of fitness, I would say during COVID, we were the frontline warriors because everybody had problem with the lungs, and we were the one expert treating the lungs, treating the chest, and bringing the patients back to the normal routine. But what we found out during COVID was most of the Indians' vital capacity. Now, God has made the lungs for 4.5 liter, but most of the Indians have it below 2 liters. So most of the patient could not survive whose vital capacity was below 1.5 liter. Very difficult. Even uh, doing our best to them, it was difficult to bring them back. So I would suggest one of the work that when we are talking about fitness or Fit India, and we have the sources, pranayam breathing exercises is one of the best source of getting increasing our vital capacity. So it should be practiced at school level, college levels, of course hospital levels, and the awareness of increasing the vital capacity should come in all of us and increase our vital capacity for better health. We take more health, more breathing, better vital capacity, more oxygen, better health. So one, and if you see in our Indian mythology, blowing of chunk was there. If you can blow 8 to 10 chunks per day in the morning or any time, that will also increase the vital capacity. Of course, we are into exercises, we are into yoga, we treat the patient depending, we see the muscles getting weak as you age, especially the quadricep muscles, the back muscles. So, showing different exercises for strengthening. Uh, Diabetes is on a rise, so most of the diabetic patients, the muscles get weaker faster. They cannot get up from the chair. Walking becomes a problem. So strengthening, we are part of it. And in all our camps, in all our doctors' day, as well as uh, any camp that we do, we show them the basic exercises for strengthening. And I would definitely encourage Sunita Dubey and her team to have more camps, more rural camps, because 70% of Indian population stay in rural area. We should emphasize more in the rural areas, reach them, teach them the basic things. And we have also found out people from the rural areas, the women especially, because they do all the household work. They don't have washing machines. They wash their clothes, they dry them. So we have found them healthier and their vital capacity also better than people staying in the cities, especially metro cities, because everything is available. There's AC room, cars, elevators. So the exercise done by a rural person and comparing to the city people, the rural people do more exercises. So I'm very sure Medscape will go in full throttle and plan more camps, more healthy living for India, fit India. So the slogan will go, and definitely one of our doctor before me did talk about, yes, there should be something for fitness of doctors. All doctors should be fit. Definitely, if a regular checkup is done or they know, I will give a very simple solution. You should measure your height in centimeters and minus by 100. That should be your weight. So suppose you are 160 centimeter, so you cannot be more than 60 kgs. As simple as that. So everybody, whether it's from medical student or from the hospital, whichever, wherever they are, they want to know the basic of their fitness. They should measure the height in centimeters minus by 100. They cannot cross that weight. Once you have crossed that, you fall under obesity. I wish and pray for everybody and all those in medical field, especially all the doctors. I can only pray that may God give you all a healing hand. I look forward for the healing hand for the people of India, and may Fit India progress. May Medscape keep rising every year, and God bless Sunita and her team. Thank you.